Do I need a brow lift or an upper blepharoplasty or both? This to me is a really important thing in how to best rejuvenate and make look younger the upper eyelid and orbit complex. And right now, I'm going to talk about the brow and the upper eyelid and leave the lower eyelid off of the discussion. Even though a lot of people have bags, dark circles in their lower eyelids, and extra skin or extra muscle, I'm not going to talk about that now. I'm going to talk about just that which is above the equator of the eye. Is it a brow lift? Is it a blepharoplasty? Is it both? Today in the operating room, I did both. I like lifting the brow and just lifting the lateral brow, not lifting the medial brow too much. I can do that in a lot of different ways. I can do that endoscopically with a couple of small incisions. I can do that with a single small temporal incision, or we even can do that with the old coronal style incision, which I rarely use today. But I often couple the brow lift with an upper blepharoplasty, taking off the skin. Now here is the important thing. If you pinch the skin of your upper eyelid, you'll see that it is very thin. It's the thinnest skin in the body. But if you pinch the brow skin is thick. And really, when the brow skin has descended and that brow drooping or ptosis contributes to upper eyelid skin redundancy, that's when we need to lift the brow a little bit. When somebody has a lot of lateral fullness, we can't really get that with eyelid or blepharoplasty surgery only. We've got to do both. I rarely do a brow lift alone. Somebody would have to have no redundant eyelid skin at all. But on a rare occasion, I will do a brow lift alone. But I will do upper eyelid surgery alone when it's just extra skin. On some young people, they only need eyelid surgery. Now, if I do a brow lift and upper eyelid surgery, it kicks it up a little bit price-wise, and it kicks it up a little bit healing-wise, because the brow lift will cause us to swell a little more, and it will cause us to bruise a little more. But it's often associated with really wonderful results. What age should I get a brow lift or a blepharoplasty? Now, this is very personal and very individual. Some individuals' eyelids are aged at 25 years of age. While I don't recommend brow lift and eyelid surgery for most 25-year-olds, some people have premature aging of their eyelids and their brow. Their brow's down, their upper eyelid skin's very redundant and excessive. They want to do something. So there's not an actual age. For me, the age really starts in the late 30s and then gets a little more frequent as we go into the 40s and 50s. But of course, there are some patients that never get any eyelid surgery until they're 65. That's not wrong. That's their choice. So there isn't a correct age to do eyelid surgery. What is important is it is important to not remove too much eyelid skin to make it so that the individual cannot close their eyelids well. And we have to have enough upper eyelid skin to close the eyes. How long does a brow lift or blepharoplasty last? I think it depends how that individual ages, and everyone ages differently. But if it's well done, it would be common for it to last 10 years. And in my practice, I'm seeing patients that I've done their brow lift and upper blepharoplasty 15 or 17 years ago. They're now ready for a lower facelift, and they're not getting anything more done to their eyelids. Or maybe we're taking a little bit of redundant skin from their eyelids, but no additional brow lift. So it lasts for quite a long time. That's what I would say. But eyes are very individual, and they're individual because we all posture our eyes in a different way. If you look in the camera at me, I raise my eyebrows a lot. So I tend to have high eyebrows. I don't really need a brow lift. But people who use the muscles that pull down their brows, the frowners, the squinters a lot, they need brow lifts more. So it depends, and that difference is not an age-related difference. It probably started when they were 18 years old, and they started to use either these muscles more, the elevators, or the depressors more. I like to look at everything related to the eye before we choose a combination of procedures to do on you. And for that reason, the consultation is very important. I look forward to seeing you in the office email me, call me. Your questions are important to me, and seeing you is the most important. I look forward to seeing you. Thanks for watching.